The liver is a unique organ, a kind of biochemical laboratory that maintains the stability of the body's internal environment on a daily basis. The mass of a healthy liver varies greatly depending on a person's growth and physique and can range from 1420 to 2300 grams. A diseased liver can significantly increase in volume, but this usually occurs in advanced, severe diseases. Such patients experience a significant deterioration in their quality of life. They suffer from a variety of symptoms, from insomnia and irritability to pain, nausea, and vomiting. This does not mean that relatively mild liver diseases do not deserve attention and do not require treatment. On the contrary, if you monitor the condition of the liver, help it during heavy loads, and promptly treat emerging diseases, the organ will serve you faithfully throughout your life. Let's talk about the liver and the pitfalls of its dysfunction. It will be very interesting. Main functions of the liver. The most well-known functions of the liver are digestive, excretory, external secretion, detoxification, and barrier functions. The liver produces bile, without which normal digestion of fats is impossible, and neutralizes toxic products of digestion, metabolism, and intestinal flora activity. However, its functions do not end there. Its metabolic function lies in the synthesis of vital compounds. The majority of plasma proteins are produced in the liver. Proteins are enzymes that regulate all biochemical processes. They are the building material for all tissues and organs. They are substances that control the fluidity of blood and keep it in the vessels. Additionally, proteins ensure the transport of various substances into the bloodstream. The liver distributes and, if necessary, synthesizes lipids, triglycerides, and cholesterol, which are the building blocks of cell walls and nerve sheaths. Without cholesterol, 80% of which is produced in the liver, the synthesis of many hormones, including sex hormones and vitamin D, would be impossible. The liver maintains a normal level of blood glucose by storing it in the form of glycogen in times of excess or synthesizing it in times of deficiency. Additionally, the liver neutralizes excess hormones and is capable of storing and depositing vitamins. Its immunological function is also important. Both hepatocytes and liver macrophages synthesize proteins necessary for the immune response. Liver macrophages engulf bacteria and immune complexes, antibodies associated with foreign antigens that enter the blood. The liver also maintains the acid-base and water electrolyte balance of the body. It metabolizes excess lactic acid, excretes various non-volatile acids and bases with bile, and neutralizes excess aldosterone, a hormone that regulates sodium and potassium levels in the blood, and consequently the body's water content. Signs of liver dysfunction. The liver has an incredible ability to regenerate. Hepatologists claim that even after the removal of 60 to 70% of liver tissue, it is capable of gradually restoring its normal volume over time. Therefore, the organ can resist external influences, the effects of excess weight, improperly chosen medications, and excessive alcohol consumption, viral infections, and intoxications associated with professional activities for quite some time. However, sooner or later, the natural life resources of the liver are exhausted. Main manifestations of liver dysfunction: dyspeptic syndrome, discomfort, heaviness, pain in the upper abdomen or right hypochondrium, diarrhea due to insufficient digestion of fats, asthenic syndrome, rapid fatigue, irritability, unexplained mood swings, sleep disturbances, inverted sleep-wake cycle, daytime sleepiness, and nighttime insomnia. Hemorrhagic syndrome, easy bruising, pinpoint subcutaneous hemorrhages, bleeding gums, tendency to nasal bleeding. In severe cases, profuse gastrointestinal and uterine bleeding, bleeding from hemorrhoidal nodes. Jaundice from subicteric to active coloring of the entire skin. Minor liver signs, telangiectasias, vascular spiders, xanthelasmus, yellowish subcutaneous plaques, leukonychia, white stripes on nails, up to complete nail whitening, palmar and plantar erythema, redness of the palms and soles. Usually, dyspeptic and asthenic symptoms appear first, but patients often do not take them seriously, attributing them to stress, fatigue, or bad food. Meanwhile, measures should be taken at this stage before irreversible changes occur in the structure of the organ. If the symptoms persist for 3 to 4 weeks, it is necessary to consult a doctor, a gastroenterologist, or a hepatologist. Typically, patients are prescribed a biochemical blood test and abdominal ultrasound. If the doctor detects disruptions in the functioning of the hepatobiliary system in the liver or gallbladder, they will most likely prescribe drugs to restore the function of these organs. These are called hepatoprotectors. Hepatoprotectors are drugs aimed at protecting and restoring, increasing resistance to toxic effects, alcohol, drugs, fatty foods, and normalizing liver function. Unfortunately, not all drugs classified as hepatoprotectors actually have a proven effect. Prevention of gallstone disease. UDCA, or ursodeoxycholic acid, reduces the lithogenicity of bile, propensity for stone formation, and lowers the level of total blood cholesterol, and therefore in the bile, which prevents the formation of stones and biliary sludge. Cytoprotective effect, cell protection. Ursodeoxycholic acid integrates into cell membranes and stabilizes their structure, protecting cells from destruction, including from the effects of toxic bile acids. This effect is manifested not only in relation to hepatocytes but also other cells, including the mucous membrane of the gastrointestinal tract. Choleritic effect. UDCA reduces the manifestation of cholestasis, stagnation of bile, promotes the excretion of toxic bile acids from the body, and reduces cell membrane damage during reflux, the backward flow of the contents of the small intestine into the stomach. Immunomodulatory effect. UDCA reduces the synthesis of biologically active substances that stimulate inflammation, promotes the activation of natural killers, cells that quickly detect and destroy foreign bacteria and viruses. It reduces the production of autoantibodies, antibodies to the liver's own tissues. For example, in autoimmune hepatitis. Ursodeoxycholic acid can be used for long courses for up to 2 years. It is recommended as a standalone medication for biliary sludge and cholesterol gallstones as part of complex therapy for many liver diseases, chronic viral and alcoholic hepatitis, non-alcoholic fatty liver disease, and others. It is also prescribed to protect the liver during prolonged intake of certain medications, statins, antibiotics, anti-tuberculosis drugs, chemotherapy drugs, and others. If you liked this video, please like and subscribe to my channel. See you later.